Hello and welcome back to EASD TV. I'm Vivian Parry and we're on to debates. Now these are one of the most popular things on the programme at EASD 2022 or indeed in any year. And the debate that's caused a lot of head scratching and there's a lot of talk around is the one about continuous glucose monitoring, and I think the actual thing is, should it be available for all? And we have two guests here who clearly believe that it should. So I have Dr. Maciej Malecki from Poland and Dr. Mina Mitraku from Greece. Hello. So let's hear it. Maciej, from you first. Continuous glucose monitoring for all. Really? Everyone?
I don't think that CGM is literary for every patient with diabetes. I don't think that every patient on metformin should be using CGM. But I think that CGM should be available for many patients with diabetes, including a large group of type 2 diabetes patients on less intensive therapy. So CGM, yes, for everybody with type 1 diabetes, yes, for everybody with type 2 diabetes on intensive insulin therapy, and yes, for many patients with type 2 diabetes on less intensive treatment, and also for GDM, regardless whether on insulin or on diet only, many patients with secondary diabetes, also for in-hospital use, including intensive care unit. So for everybody, maybe not for everybody literally, but for many, and this number is on rise.
But there must be an enormous cost associated with this because, CGM is not cheap, and we've already got a ballooning cost of diabetes. I mean, most health authorities around the world must surely be thinking the world's gone mad if we have to give everybody CGM.
It definitely costs more than the finger sticks. And if you can imagine that a person to be well treated or well managed in diabetes needs more than 10 finger sticks a day, then CGM is almost the same price. Actually, you have to think of the people who do not lose days going to the outpatient clinic, who do not lose days to go to the doctor, who can manage their diabetes on their own, or who can get on the web and manage their diabetes through the line. So in that term, CGM is cost effective, and there are studies who have shown that. It's the Diamond study, the best study done on CGMs early on, and it has been done in type 1 and type 2 adults on insulin, and it has shown that it is cost effective.
So are you going to be able to convince your authorities either in Poland or in Greece that the data is really there, it's going to cost them less? Surely that's going to be a hard sell.
We have more and more evidence that this tool is cost effective. For example, there was a paper this year published in Canada, from Canada, by Bruce Perkins' group, and they do a modeling study, sort of predicting the cost of CGM and IS CGM for, I believe, 20 years from now, and amazing. The cost of SMBG was almost the same as IS CGM. The difference was almost negligible, and we were getting a clinical benefit, so it was value for money. Yes, for real-time CGM there was a difference, but again, they predicted more people living complication-free and more people surviving these 2 decades. So I think that we'll have more and more evidence that this should be available for many patients and should be covered by the healthcare systems.
Nevertheless, there will be a suspicion amongst many that this is driven by the manufacturers of CGM devices because, clearly there's a lot of profit in it, and people, particularly in health systems, will be concerned that actually they're being taken for a ride by the manufacturers. Is that true, or you're shaking your head?
It's expanding. There is an evolution on CGMs. You see more and more coming up, more and more companies getting in the field, so there will be competition. So it's not, they don't take advantage of the patient is taking advantage of the CGM to be better controlled, if you agree.
Sure. There are always manufacturing companies, pharmaceutical companies, but we are independent clinicians, researchers. We should make our mind in an independent way. I have to admit that I have a special conflict of interest in this context, because I am a patient with type 1 diabetes for 30 years now, and I have been using CGMs of many companies over recent 10 years, and believe me, this is a new life, and I wish every patient with diabetes in Europe should be able to get an access to this, and many should have it.
And actually what we're seeing is that this is going to be driven in part by people living with diabetes. Yes. Because when they see other people who have CGMs, they want it too, and they want the certainty and the comfort that a CGM monitor gives them.
But they want this for a good reason. They want it because they have, I would say, access to first line witnesses, I would say, for the actual users, and they report them about the improvement in glycemic control. They report them about improvement in quality of life, improvement in terms of safety. There is nothing wrong, I think, in patients, claiming the access based on the reports of other patients.
Now, I want to ask you a final question. Mina, I'm going to start with you, which is, in 5 years' time, will there be a debate about this, or will it be a done deal? Will it be that everybody has CGM and it's just not a debate any longer?
It seems to be the way, because even from this year, the guidelines, even the NICE guidelines, expect everybody of type 1 diabetes to wear a CGM. And it will expand to type 2 on insulin, and even to type 2 just for education reasons. I mean, even the person on metformin will be able to wear it just to educate himself, not that he needs it to manage his glucose control. So for insulin-treated patients, I think there will not be a debate in 5 years.
Agree. I think that in 5 years from now, we'll not be debating about CGM in patients on intensive insulin therapy, and a lot of patients with less intensive insulin treatment or less intensive treatment in general will be using this.
And as a long-term guinea pig, if I can put it that way, of many different kinds of CGM, where do you think that technology will have settled? What will we see in 5 years' time? Will it be just kind of better versions of what we have, or something different?
Well, it's really hard to predict. I think that this technology of subcutaneous sensor, this has a large potential, and I will be watching with a growing interest, new developments, particularly in this area.
Mina?
Yeah, the longer the CGM stays in your body, the better it is. It's more relaxing for the patient. So the implantable one will be the future.
Fantastic. I think you pretty much won the debate as far as I'm concerned. But it was a really, really good session. So do please go and watch it if you missed it on EASD Web Services. Thanks very much. Bye for now.